Hello, and welcome. Welcome to Saliva Cast, the podcast that brings salivary science to your clinical practice. I am Dr. Deborah Heller, a dentist, a scientist, an educator, and my mission is to advocate for precision salivary diagnostics, is to bring you knowledge about how to incorporate salivary diagnostics to your clinical practice so you can take better care of your patients. And today's topic is both urgent and often overlooked. Over 30 million women in the country I am today are currently in perimenopause or menopause. And this number is equivalent in every country in the world. And yet, this transition often goes unnoticed in the dental chair. And this needs to change. Is your patient entering menopause? And most important, what is her saliva telling you? And how can you act on it? So let's dive in. Let's dive into science, clinical practice, and the dentist's essential role in this journey. So, why is it that many times the mouth feels it first? Perimenopause can start subtly, but often between ages 38 and 50, and symptoms are vague and usually blamed. And as a woman, I know this very well. I just turned 40 last year. So usually the symptoms are blamed on stress or lifestyle, but the oral cavity is often the first place to show changes. Why? Let me explain to you in a way that it's very easy to understand. Because estrogen receptors are actually found in salivary glands, in the oral mucosa, in gingival tissues, even in the periodontal ligament and the alveolar bone. So once estrogen declines, salivary flow decreases. Saliva becomes thicker and less protective. And we're talking about the guardian of your patient's oral health. So your patient now has less protection, and consequently, her mucosa will also become more sensitive, becomes thin. Inflammatory response intensifies, especially in gingiva. And of course, the microbiome, the oral microbiome, especially the mycobiome, fungal, becomes unbalanced. Let me bring this to the clinical practice. I'm talking to you from my dental clinic, from Saliva Clinic here in São Paulo, Brazil. So let me give you a real clinical case that happened this week here in our clinic. A 48 years old patient reported dry mouth, discomfort when eating toast, and this new burning on her tongue. Absolutely no systemic diseases, no medication. She simply said, my mouth feels different. And of course, at the Saliva Clinic, like you should be doing at your clinic, we did all saliva testing. And what we saw in the salivary results is borderline resting flow and early signs of dysbiosis. So we already saw through the saliva testing that something was changing there. And because we did the saliva testing and we incorporate this in our daily clinical care, we could anticipate ourselves. Anticipate before this patient came with cavities or with gingival inflammation or complaining of bad breath. I could anticipate because I already saw the first signs, the changes in her saliva. She had no official menopause diagnosis yet, but her mouth was already telling the story. So, what does science says? There is a recent, very interesting review showing the changes in the oral microbiome in postmenopausal women. And the highlights of this review, let me bring here to you, are very interesting because estrogen deficiency leads to atrophy of oral mucosa, making it more fragile. And what comes in consequence is this fungal growth increasing, especially candida, local immunity weakens, and many times those are women that are also making use of common medications like antidepressants, anxiolytics, antihypertensives that even worsen dry mouth and dysbiosis. Translation. Our role as a dentist goes far beyond prophylaxis. We are also agents of early diagnosis and systemic health promotion. Health begins in the mouth. Estrogen impacts inflammation, collagen production, bone metabolism, oral and gut microbiome balance. And saliva is the ideal biomarker, is the ideal early sign, clinical early sign to detect and monitor even the most subtle yet impactful changes. Many women, they report oral changes even before they receive any medical diagnosis of menopause. Estrogen declines affects acinar cells of the salivary glands. It affects also the autonomic regulation of salivary flow. And consequently, we see an alteration in saliva's composition, pH, electrolytes, enzymes. It all changes. And of course, the antimicrobial defense will change, and we'll see a more prone woman to dysbiosis, to not having a balanced oral microbiome. What your patient may tell you, and you were just not associating it with menopause or perimenopause, is they may come and they say, I wake up with dry mouth, or food feels rough on my tongue, or my taste is different, or they even may say, brushing my teeth burns. These are clinical clues, simple, yet very powerful. So, what can we do as dentists? Practical tools. Here, I want to bring you now some practical steps to implement today in your clinical practice. First step, update your medical history form. You need to start asking more. You will not solely ask what brings you here today, are you in pain, or that this is our questionnaires that we did like 50 years ago. We continue to do so, but we add. We need to see the patient as a whole body, connected, mouth and body connected. Salivary or brushing discomfort, we need to investigate for that. Sleep disturbances, we need to ask. Menstrual changes, yes. It is part of us taking care of our patients to question them beyond the oral cavity, because those hormonal changes impact the oral cavity and will impact the treatment, the approaches, my planning, my prevention that I'm doing today in my office. Nowadays, we cannot have an appointment without asking about medication. Use of antidepressants, anxiolytics, antihypertensives, it all, we must ask about them. They alter saliva and we must know about them. Ask, ask, ask. Family history of early menopause or osteoporosis, make sure you ask. And after you now incorporate a even more complete anamnesis, a medical history questionnaire, make sure you also use saliva as a diagnostic tool. And in fact, I want today to go even beyond the clinical test. Let me make it clear. You can do all saliva validated clinical tests today in your clinical office. You get results right there. You use this to communicate with your patients. You use this to plan even better treatment, to individualize your prevention approach, to be even more proactive, to give tools for your patient to be more proactive about their own health and to understand what's happening in the oral cavity and in their body. And you have much more successful treatment and outcomes in your office once you incorporate all saliva clinical tests. Clinical tests, no lab needed. So I'm talking about saliva flow rate, measuring salivary pH, salivary viscoelasticity, asking about dry mouth sensation, xerostomia, even the clinical oral dryness score. It's a clinical exam that we know to see signs of oral dryness. Okay, you do that. If you want step by step to learn how to do so, I teach you at Saliva Pro. You're most welcome to join and to learn. We have Saliva Express, all in English, for you to learn very quickly how to incorporate all clinical saliva tests in your clinical practice. But you can go beyond. Salivary hormone testing in saliva. Saliva as a diagnostic tool. Salivary hormone testing measures free bioactive hormones truly available in tissues. Why it matters and why, if you, after you listen to this whole episode of Saliva Cast and stay here because it's really interesting, after we finish, you go and you call the lab. In any country you are right now, call a clinical exams lab and ask, are you doing hormonal testing through saliva? If it is a good laboratory, the answer will be yes, because saliva shows the hormone, the bioactive hormone, what is bioavailable and usable. Now, that's why even for some hormones now, saliva is the gold standard biological fluid. Blood tests can appear normal, especially in patients with metabolic changes, medication, or subtle hormonal shifts. But saliva testing avoids interference from protein carriers, which will affect the test results. So the clinical advantages of saliva testing is that it is a sample that is very stable at room temperature, so it's easier to collect. You don't need to rush to freeze it. So saliva is actually more stable. It's absolutely needle-free and pain-free. So the patient can collect at our dental office, at home, at their school, at their work. And you are able to have, by this non-invasive saliva collection, also circadian rhythm analysis through hormones like cortisol or melatonin. And this is ideal if you have a patient that is needle phobic or have limited access to a lab. So what can we see? Let's see this together. Hormones and markers accessible via saliva. Cortisol, estrogens, when we're talking about perimenopause and menopause. So estrogens, progesterone, free testosterone, DHEA, DHT, aldosterone, melatonin, secretory IgA. You can also do monitoring of electrolytes, do microbiome testing through saliva. You can do it all. You can go even beyond the hormones like I just mentioned. So let's check some common clinical scenarios here to bring you back to our dental practices. Sometimes us as dentists, we can identify oral changes and refer with salivary evidence. So this is one more tool you now have available to use in your clinical practice. And remember, saliva reflects the active fraction of hormones. Best practice, of course, is to combine with clinical judgment and oral findings. And okay, I can do saliva clinical tests, no lab needed. I can check for hormones in saliva, wonderful, needle-free, painless, super practical. But what can I recommend to my patient today that will have already an impact? Well, start with SLS-free toothpaste. Sodium lauryl sulfate is a big mucosal irritant. In my opinion, this should be out of any toothpaste in the market. And there is already some big players in the industry that have already taken it out. So it's about time we understand SLS or sodium lauryl sulfate is not a good detergent to put in toothpaste. It can cause irritation, even ulcers, discomfort, pain in the oral mucosa of patients that are having these hormonal changes, for example, during menopause and perimenopause. So just start with the right one. Recommend an SLS-free toothpaste. There's plenty in the market. I can tell you a few. Sensodyne has some of its toothpaste without SLS. Curaprox, Curaden, all its toothpaste. None of them have SLS. They're all SLS-free. So they're all ready for you to prescribe to perimenopause and menopausal woman. And you will see the difference this makes. I remember a patient coming to my office, and all I did was to change her toothpaste, and she sent me this audio message saying, Dr. Deborah, you're an angel in my life. It doesn't hurt anymore to brush my teeth. That's the impact. And it's not solely on her oral health, oral hygiene. Of course, there is an impact there, but it's in her quality of life. So now she'll live better and longer. Talking about longevity here, health span, squaring the curve, like we like to say. Also, alcohol-free mouthwashes or none. Many times you do not need a mouthwash. Soft toothbrush, always. Tongue scraper, a big friend. And try to prefer for fluoride and microbiome friendly paste. Hydration will be key. So you want to guide the woman to hydrate with water or even herbal teas like ginger and mint that stimulate saliva even more. And they can also make use of saliva stimulants that are naturally found, like crunchy food, sugar-free gum, fresh ginger. And of course, as dental professionals, we will refer when needed. If a systemic or hormonal signs arise, we'll recommend a gynecological or endocrinological evaluation. And we'll use our clinical findings, our oral findings, as a clinical rationale. Dentist, the mouth speaks, and now you know how to listen. With saliva, you start seeing what before was invisible. Your patient may never say, Doctor, I think I'm starting menopause. But she may say, my mouth feels different. Brushing is uncomfortable. My taste has changed. Dentistry gives us powerful window into subtle physiological changes. The mouth speaks before the body screams. Menopause isn't just hot flashes or mood swings. It involves dysbiosis, inflammation, and mucosal fragility. And saliva, yes, your patient's saliva reveals it all. This episode, it's just the beginning. I invite you to join us at Saliva Pro to bring saliva testing to your clinical practice. You'll find the link for it in my bio on Instagram, Dr. Deborah Heller on Instagram. You can also contact me by email, Deborah, Debora, at salivapro.com. And you can also sign up for our free newsletter. Every Monday, I send you saliva news directly on your inbox. And always my goal is to share practical clinical insights and a guide to implement salivary testing in your clinical practice. As always, I invite you to follow me on Instagram, to like SalivaCast. Make sure you leave us a comment. I'll be very happy to listen to your thoughts. What are you enjoying? Would you like more tips, more science, more behind the scenes context? What would you like to see here at SalivaCast? I am Dr. Deborah Heller, and this was SalivaCast, where saliva meets science and science transforms your care. I'll see you next time.